Home health care gives patients the opportunity to receive care from their physicians and nurses in their own homes, which studies show maximizes the healing process. If given the choice of receiving care at home or at the hospital, most choose the comfort and security of their own home. Home health can provide a variety of services such as an intermittent skilled nursing care, physical therapy, occupational therapy, speech-language therapy, social services, and a part-time home health aide. These services play a key role in delaying or preventing more costly services and helping people remain in their own homes. 5 different health policies that provide funding for care to individuals in their homes. The different policies are Medicare, Medicaid, the Older Americans Act, the Veterans Administration, and private insurance. This funding is extremely important because without it, millions of individuals will not be able to delay hospitalization, keep costs down individually and nationally, and remain in their homes as long as possible.
Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. The program is funded jointly by the states and the federal government. In 2018, over 65 million individuals were enrolled in Medicaid across 51 states, including the District of Columbia. Qualification for free of low-cost care through Medicaid is based on income and family size. The Affordable Care Act of 2010 created the opportunity for states to expand Medicaid to cover nearly all low-income Americans under age 65. Medicaid is the single largest source of health coverage in the United States. Medicare is the federal health insurance for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease. Medicare is made up of 3 parts. Part A includes your hospital insurance. Part B covers your medical insurance. Part D is your prescription drug coverage. And lastly, Part C is a plan for a combination of all coverages. The usual age of eligibility for these benefits is 65, although certain people qualify for the program earlier. Medicare is available to people under age 65 who have been eligible for Social Security disability benefits for at least 24 months or who have end-stage renal disease.
The Older Americans Act supports a range of home and community-based services, such as Meals on Wheels, in-home services, transportation, legal services, elder abuse prevention, and caregiver support. These programs help seniors stay as independent as possible in their homes and communities, as well as help avoid hospitalization and nursing home care. People age 60 and older are eligible to receive Older Americans Act services. Each state receives funds according to a formula based on the state share of the U.S. population age 60 and older. While the program is open to older individuals, it focuses on offering assistance to persons with the greatest social or economic need, such as low-income or minority persons and older persons residing in rural areas. The Veterans Health Administration is the largest integrated healthcare system in the United States, providing services to over 9 million veterans enrolled in the Veterans Affairs Healthcare Program. You may be able to get Veterans Affairs healthcare benefits if you served in the active military, naval, or air service and didn't receive a dishonorable discharge. Long-term care services provided by the Veterans Administration include 24/7 nursing and medical care, help with daily tasks, comfort care, and support for caregivers who may need skilled help or even a break. The care settings where veterans can receive care include nursing and assisted living homes, private homes where a caregiver supports a small group of individuals, adult day health centers, and in the veterans' own homes.
Private insurance can include private health insurance, private pay, or long-term care insurance. Long-term care insurance is based off your inability to perform certain ADLs to determine when you can start to receive benefits. Often individuals become eligible for benefits when they need help with 2 or 3 ADLs. There are many barriers for individuals to qualify for home health care. One of the biggest barriers is Medicare has allowed home health coverage to be used primarily for short-term use, which creates barriers for individuals who have long-term and chronic conditions, which can lead to a higher readmission rate in the hospitals. Another barrier, because there is not enough funding for home health care, is agencies are more likely to choose cases that are more profitable to their organization because the Medicare's prospective payment system gives minimal reimbursement for increased covered unskilled services that home health nurses provide. The Triple Aim is a framework that was created by the IHI to optimize the performance of our healthcare system. It is based on the idea that to improve the system, we need to simultaneously pursue 3 dimensions: improving the patient experience of care, including quality and satisfaction, improving the health of the population, and reducing the per capita cost of healthcare. The Institute for Healthcare Improvement believes that to do this effectively, it is important to harness a range of community determinants of health, empower individuals, substantially broaden the role and impact of primary care and other community-based services such as home health, and assure a seamless journey through the whole system of care throughout a person's life.
Nurses have a significant role in home health because they ultimately provide the services. These include wound care, patient education, IV therapy, diabetic care, catheter care, and pain management. Nurses contact their patients, go into their homes, provide care, and then follow up with their patients as needed. Across the country, states are cutting funding for home health coverage. Nurses can be at the front line of these policy changes by raising awareness to other community-based nurses, floor nurses, and case managers that refer patients to home health agencies. They can also contact their local government agencies to receive more information and eventually lobby to their state department on this key issue. Nurses can take several different action steps to make home health physically, emotionally, and financially beneficial to its clients. To start, nurses can keep their patients at the forefront through continued advocacy. Nurses should understand the available resources in their community, such as local insurance agents, and they should understand their own agency's policies to provide optimal nursing care. In addition to this, nurses should always be prepared to fight for the policy change that most benefits the health of their community. They should be aware of previously gathered data, and they should document their own data to provide practical evidence in support of home health. Most importantly, nurses should continue to provide skills to their highest ability despite a lack of home health funding, because the holistic health of patients is of the highest priority.